that might be different from normal from Mr. Cassius, but I'm going to ask that you put your phones away and that you look up this way. So what I really appreciate, tomorrow is Epilepsy Awareness Day, but we're recognizing it today. And so while we have multiple students and probably adults on campus at Collegium who do have epilepsy, we have Addie Wright, 9th grade student, your fellow peer, who is brave enough to share her story today, and her parents who are here to talk about their experience as well as some education about epilepsy. So I really am asking that you just give your attention to them. And so again, earpods out, phones down, and give attention. And this is open. If you have a question, raise your hand. There will be times throughout the presentation that we'll just stop and see if you have questions. But I appreciate your attention, Addie, and Mr. and Mrs. Wright. So thank you, students.
Hello guys, so we're going to start out with the video that's from CCS that they did an interview with Addie, and then we'll go from there, okay?
So we're here interviewing Addie about epilepsy. So tell me, what is epilepsy?
Epilepsy is a disorder where brain cells act abnormally and cause seizures.
How old were you when you were diagnosed with epilepsy?
I was 5 and was in kindergarten.
Is there a cure for epilepsy?
No, but there are treatments to help control the seizure.
So what are some of the treatments for epilepsy?
Medications, magnet, ketogenic diet, and brain surgery.
You said that one of the treatments is a magnet. How does that really work?
Well, you can take the magnet and you put it against the chest and you can swipe it across to your chest and it will shock you.
Oh, that's interesting. And so is epilepsy contagious?
No, you can't catch epilepsy from anyone else.
Is it painful?
I don't feel like it, like my seizures are painful when they are happening, but I sometimes have headaches, sore muscles, stomach aches before or after my seizures. Sometimes people injure themselves during seizures by falling and hitting things.
Hey, Addie. And so can people with epilepsy live like happy and normal lives?
Yes.
So thanks for coming and talking to us about epilepsy and all of that kind of thing. It was really brave of you to come and talk about it.
Thank you.
So, like Ms. Corsemelia said, tomorrow is World Epilepsy Day, and so Addison just wanted to kind of give a little presentation on epilepsy, what it is, a little bit of her story, and just raise a little awareness. I think it says later in one of the slides that epilepsy is much more common than people think it is. 1 in 26 people in the world have epilepsy or will be diagnosed with epilepsy in their lifetime. Epilepsy is characterized by seizures, but there are a lot of different kinds of seizures. So it's a lot more common than you would think, and probably a lot of people at this school have it. We just wanted to raise a little awareness and kind of let maybe some things that you can do to help. Addison made this slideshow, kind of a little bit of information. So she was diagnosed at the age of 5. That's when she had her first seizure. She was getting ready to go to kindergarten. She was eating her breakfast. that was the first seizure she ever had. She wasn't sick. There's really nothing else going on. It was kind of came out of the blue. But seizures or epilepsy can be diagnosed at any age. It's most commonly diagnosed between the ages of 10 and 55, but really any time. Addison spent a lot of her early years in the hospital, not quite as frequent now, but she still does go where they do regular testing, blood work, and images of her head just to make sure, everything's going, but that her brain is fine. Here she listed some symptoms of epilepsy for us, so temporary confusion. Some people's seizures look like staring spells. Some people have uncontrollable jerking movements of their arms and legs. Some seizures cause loss of consciousness where they basically pass out or are unaware of their surroundings. Some people do remain aware during their seizures, but they can have symptoms like fear, anxiety. They can get very angry and have like emotional outbursts. They can get confused, have headaches, or sleepiness. So she touched on this. There is no cure for epilepsy, but it can be managed with different strategies. These include the ketogenic diet, which I'm sure a lot of people are familiar with because of its popularity right now, but some epilepsy patients are put on this diet. It's very high fat. It's very strict for the patient, for people with seizures. Addison was on it for 2 years. I mean, I'm not kidding when I say that she might eat like a stick of butter a day and just like eat the stick of butter. She would have to drink cream, mayonnaise, like a lot of oils, like just drinking the oil to get the fat content of it. She did it for 2 years. Some people get really good seizure control from the ketogenic diet. Unfortunately, Addison did not. She didn't get enough control that it was worth staying on that. And it was really difficult. You have to weigh your food. You have to eat at specific times of the day so that your body can stay in this like ketosis. So we did take her off of that. She does have a vagus nerve stimulator, which is the magnet that she talked about in her video. It's implanted in her chest right here underneath the skin. It's shaped kind of like a pacemaker that some older individuals have. It's got a coil that wraps around her vagus nerve and goes up the side of her neck to her brain. And it sits right alongside her vocal cords, so that's why sometimes her voice can sound different or deeper. But what it is it sends continuous impulses of electricity up the side of her neck into her brain. And if, her heart rate increases, if, things like that, it will start sending more of them. And try to, like, if something funny is going on in her brain, it will try to send an impulse to kind of like reset it. So she does have that. There are ones that you can actually place on your brain. They're called an RNS, but those are mostly for adults, I think, over the age of 20 or 24 or something like that. So you can have brain surgery. Some people get surgery to remove a portion of their brain that the seizures are coming from. Usually that's a last resort because it can lead to some deficits. People can lose the ability to use maybe one of their hands or things like that. Addison's not a candidate for that because her seizures come from different areas, so there's no one area we could remove, unfortunately, to stop the seizures. We went over this already. Tomorrow is Epilepsy Awareness Day, but November is really Epilepsy Awareness Month. Our goal, we are very active in the Epilepsy Foundation, is just to gain awareness, maybe to raise a little money that maybe one day there can be a cure for people with epilepsy. And Addison found these facts for us. 1 out of every 26 people will have a seizure in their lifetime. Anybody can develop epilepsy. There are many different types of seizures. Epilepsy is not contagious. And the one big key point is if you see somebody having a seizure, don't try to put anything in their mouth when they're having a seizure, and never try to restrain them while they're having seizures or to hold them down. These are some general first aid for seizures that Addison found. Mr. Wright's going to go over some more, a little bit more, but the most important thing, and the reason like we want to be here to tell you guys about them, is the most important thing is if you see somebody having a seizure, stay with them. If you have a watch on, check the time. It's good to know how long a seizure lasts. But keep them safe, and that just means like making sure that they don't hit their head on anything. If you have like a sweatshirt you can shove under their head. If they have tight clothing on, like they're zipped up, loosen it. Don't even go near their mouth, because they're so unaware of what's happening to them when they're having a seizure that you could get bit accidentally, you could get, that kind of stuff. Don't try to hold them in or restrain them. And then stay with them until they're awake and alert, or until, an ambulance comes, if an ambulance has been called. Reasons to call 911 for a seizure. Seizures that last longer than 5 minutes. If the person's not breathing right, if they have injured themselves when they fell, or if it's their first seizure that you know of, you should always call an ambulance. In Addison's case, her seizures normally last longer than 5 minutes. We don't normally call an ambulance for her only because that's her normal and she has a diagnosis. But otherwise you would want to at least have the EMS come out and see the person.
So if I can, sorry, one of the things a student asked in the other class is what about at school? Who would you contact at school? So Addie does have an aide with her during the school day to make sure that, she doesn't fall, that she wouldn't hurt herself. And, yesterday Addie witnessed the teacher having a seizure. And so Addie stayed with the teacher, shouted out for help. And so you could do that, shout for help, someone will get the school nurse. So you may experience that in your environment here at school or outside of school.
Anybody have any questions? All right.
So he's just going to pull up his slide. Mr. Wright is a paramedic, and he does training for EMTs and such, so he'll do some seizure training. So he's just going to go over a couple slides, not the whole slideshow. But I didn't say this in the other classes, but one thing to remember that is so important, and I don't know why I didn't say it, but epilepsy really is not just a seizure. Like, it's great to know how to take care of the seizures, but so people with epilepsy, it really does affect their whole life, right? It affects everything that they do. And we did talk about in the other classes, sometimes even just, it's not, epilepsy's not a mental illness, it's not a cognitive disability, but it does cause some things that, you may notice with people. It doesn't necessarily mean that they're not intelligent. It doesn't mean that they can't have this normal, healthy life and do very productive things. But, sometimes Addison has some processing issues. So going from her brain to her mouth or to her hands can be very difficult. She does have memory issues. Long-term memory is pretty good. Sometimes the short-term memory has some issues. So it can affect people in all those ways. But you can also be very productive in your life. There are a lot of people in history that you wouldn't think have it, and a lot of people right now, a lot of musicians have epilepsy. A lot of inventors have epilepsy. So it's not something that can't be overcome, but it isn't always just seizures. But the day really is just to let everybody know how they can help if someone is experiencing a seizure.
So this is slideshows that I use for EMTs and things like that when we're training them. I'm not going to go into the full thing. It is from the Epilepsy Foundation. They've sent this to me, and this is what they go over with new EMTs. Seizures may appear as a cry, fall, followed by convulsion movements of the arms and legs, shallow interrupted breathing, or cyanosis, which is when they turn blue, your fingertips, your mouth, things like that. You're slow to return to consciousness post-seizures. Usually when someone has a seizure, it's a lot of work. When their brain is firing off incorrectly, and you're stiff or you're shaking, it takes a lot out of your body. So when they are coming out of the seizure, they'll be very confused. It's almost like you restarting your computer. When it restarts, it has to go through the setup process and all that stuff. That's what your brain's doing after a seizure. It's resetting itself up to be able to talk to you, to be able to respond to you, things like that. If a person comes out of a seizure and is not talking to you, it's because they're trying to, but they can't. It's just not working properly yet. Things that happen is, their brain is shooting off everywhere, and it's just not ready to talk. Seizures may be a blank stare, a chewing sensation, or other repetitive movements. It could be wandering, confused, incoherent speech, crying, screaming, running, falling. They have muscle tone loss. Some people pick at their clothes like that or stuff. Causes of seizures. High fever is the number one big thing that parents get confused about. Is like their child will have a high fever, and then they'll give them medications to reduce the fever, and then they try to cool them down real quick. It's a febrile seizure. Most little kids have them when they've had a fever or were sick, and parents freak out, sort of like we did when she had her first seizure. It's just something that, it's just because of the change in temperatures. Addie has sort of the same thing almost. If she's in a cold building and goes outside into the heat for gym or something like that, she can have a seizure. Same thing as when she's outside and it's cold or hot, and she comes in and it's warm or cold inside, she can have a seizure that way. Excuse me. Sorry. The other things are drug use and alcohol withdrawal, near drowning for lack of oxygen, or in other cases, metabolical disturbances, usually like someone that has blood sugar issues. Sorry, I can't think. Head trauma is another big one. So if you're in an accident or if you've hit your head really hard, things like that can cause seizures. Tumors, infections, and strokes are another one. And then diabetes and pregnancy. Like Addie said, epilepsy is not contagious. It's not a mental illness or congenital disability. It's just it's a function of your brain that isn't working right. Just went over these. There's different types of seizures. Tonic-clonic, which usually lasts 1 to 3 minutes.
Can I interrupt, Mr. Wright?
Yep.
So someone had asked in the last class, do people with seizures usually have the same seizures? And so Mrs. Wright had shared, was that Addie's, the tonic-clonic that you
Yes.
just did?
Yeah.
That generally has the same type of seizure. And how is that known? Is that through what kind of testing?
EEGs.
Do EEG to know that?
So this is the kind Addie has here, it's tonic-clonic.
Also how she presents.
And how she presents, yeah. These are simple partial seizures. They usually last less than a minute. This is more of the tingling, weakness, things like that. Twitching, arms, legs. Complex partial, these are confusion, altered awareness. This is the one where like they pick at their clothes, things like that. The chewing, mumbling. So there's a lot of anti-epileptic medications. Addie takes pills 3 times a day, 6 a.m., 6 p.m., and then 8:30 p.m. In the morning, she takes about 14 pills in the morning. At night, at 6:30, she takes about 12 pills. And then at 8:30, she takes about anywhere from 6 to 8 pills at night.
And they're not all anti-epileptic pills, but a lot of them are to treat the side effects of the anti-epileptic pills, so it's kind of all a thing, you know?
Right, so she takes, it's not all just the epilepsy pills, there's other pills that she takes.
I appreciate something Mr. Wright shared. So while we might appreciate daylight savings in the fall, we get an extra hour's sleep. Rumble when in the spring, we lose an hour of sleep. It really affects.
Right, so Addie, when she doesn't take her pills, it can cause a seizure when she doesn't take them in the correct times. Daylight savings, all that kind of stuff, we have to compensate for that and try to figure out, okay, is she gonna take them a half hour early, is she gonna take them a half hour later, just so we can get on the correct time in between them to take them.
And we have so many things set up in our house to make sure she does take them because they're so important. So her phone tells her it's time. Alexa makes an announcement that it's time to take her medications. So we have a lot of things in place because she really is so dependent on her medications.
And another thing with the medications is that her getting sick, especially during like the pandemic, we try to keep her away from everybody. We tried to keep her with a mask on. We tried, not taking her out to different places. She did get her vaccines and all that kind of stuff. But the problem, if she gets sick, or even if she just catches the flu or stomach bug or anything like that, is if she gets sick and throws up, then she doesn't get to take her meds because they won't stay down. And not taking your meds leads to seizures. So it's like a ball rolling down the hill. You can't do this, you can't do this, you can't do this, and now this is going to happen. So that's one of the problems of taking medications and things like that. This is the vagus nerve that we were talking about. As you can see how it's coiled around the nerve on the side. This is what we were talking about earlier with the sleep. If she doesn't get enough sleep, it can cause seizures, dehydration. And he doesn't have the flashing lights so much as other people that have seizures, but that is a big factor in a lot of other people that have seizures. Like when the fire alarm goes off, that bright flashing light can trigger seizures.
Excuse me, that slide that you just showed about control, if you want to speak to that, either of you, about some people, life can be free of seizures if you have control over the seizures, right? Addie is not at that place right now that she has control over the seizures, but commenting about people that we know, you comment about Thomas Edison was someone with seizures, Prince, Elton John, so people can lead very productive, full lives and have control over their seizures. They may never seizure again, you shared.
Right, I mean, some people get, like I said, get control from the diet. Some people find one medication or find a couple medications that really work for them. I think right now Addison takes 3 anti-epileptics. But I would say since she was 5, she's maybe tried 12 of them. And some just didn't work right away. So, you have to find the right combination for you. Unfortunately, she still does have them, a few every month normally. But she can go for stretches without. So it really is just, dependent on the person if they find the right thing for them. Some people can get control. They'll still have the diagnosis of epilepsy, but they could go for a very long time without having a seizure.
Yeah, so there could be students or teachers or aides or whatever in the school that are considered, epileptics, but they don't have seizures anymore right now because of medications they're on, or they found ketogenic diet that works for them, and things like that. One of the other things we've tried with Addie is, as you can see, that's Coco up there with her. It's a puppy. We rescued Coco from a rescue. We started training her to be a seizure response dog so that she can help Addie. detect seizures, and if she had a seizure, usually you can teach them to comfort her or lay under them so that they don't, she doesn't hurt her head. She can lay under her, carry her meds with her, things like that. So we started all that process, and then COVID hit. The problem with that is that when you're training a dog for this, you have to take them with their vest on into public places, and you have to teach her not to interact with people. So when she has her vest on, she's working. So she means that when she had her vest on, she was supposed to be focusing on Addie and keeping her attention on her. Problem with COVID, we couldn't go out to stores. She couldn't come to school because you guys weren't in school. So for 2 years, she didn't get the proper training to do that. And the Epilepsy Foundation will only send the training person to do that while they're young. They need to be 6 months to a year old to do that. Now Coco, when we got Coco, right away started alerting us when she was a puppy. Even before any kind of training, she started barking at Addie before she'd have a seizure. She picked up on it right away. So 10, 15 minutes before she has a seizure, Coco will stand at her and bark before she has a seizure. So she's great at home with it, but out public-wise, we can't take her right now because all she wants to do is have belly rubs. She's a lab, and she loves belly rubs, so that's one thing. Does anybody have any questions on anything?
Are there any signs that we, like humans, can see before it happens? Like, how the dog can see it?
So there's not, other than Addie sometimes gets an aura, like she'll feel something wrong and she'll have a headache, or she just has that feeling that there's something wrong, and she can tell us. There's not too much anybody else can see that could let you know. There is sometimes she starts doing like a stare to one side when she's about to have a seizure. So that's one thing we know, that when she's about to have one, that's happening. But anybody can have one. Like the teacher yesterday just had one out of the blue. No one knew what was happening.
Was that one of the?
Yeah, there's
Okay, so
something
but that's
like that.
not Addie's.
No, Addie doesn't do that, yeah. Anything else anybody has?
So I want to thank Addie and Mr. and Mrs. Wright for coming here, for being vulnerable enough, for sharing her story. That's really brave of her to be able to do that. So can we just thank them for coming? And I appreciate everyone's attention and respect and asking questions and just being alert to this. So thank you. Continue to wear your ribbons today, and thanks for wearing purple.
Thank you.